Well, happy Monday, everybody, and we're going to go ahead and get started. And welcome to the first ever simulations learning community for nutrition and dietetics educators. My name is Catherine Fake. I'm actually the chair of the in-depth simulations committee, but we've recently had such a wonderful interest in simulation that we thought that it would be a really great idea to start a learning community. And so welcome to our first meeting. This meeting is being recorded just to have it available for the people who cannot join us today. So this is our outline for today. We'll just kind of talk about the purpose of the simulations learning community, and we'll go over some data on who we are based on the roster form that I asked many of you to fill out. And then we already have our next meeting planned for December and a really awesome speaker for that meeting. And so I'll let you guys in on that. And then we'll go ahead. We have two really wonderful speakers today. And so we'll be listening to their presentations. So the purpose of the simulations learning community, and I think that we can all share this same purpose. I feel like this is just a really great safe space where we can all share ideas and really just support one another. I thought this would be a really great place where we can share current practices that we're all doing at our universities and within our own programs. We can highlight some innovative uses of simulation by some of our educators. We're here to provide resources for each other. We're also here to provide mentorship, especially to those who are new in education or new at simulation or have not used simulation before and are really wanting to dive into that learning activity. And then, of course, just to network with each other. I think this is a wonderful opportunity to get together and network with each other. And of course, just learn something new. I think we all have really great ideas to share and we can really all learn from each other. So I wanted to go over just a snapshot of really who we are, who is this learning community all about. And I've asked each of you to complete the roster form. It was a short link that I sent out to a Google form. And I actually got 53 responses. So that was a really great response rate. And so I asked you guys, what type of dietetics program are you affiliated with? And so it looks like the majority of the people who filled out the form were from dietetic internship programs, followed by DPD programs. And then we had 13 from the graduate program, 11 coordinated programs, and 2 foreign education programs and 1 DT program. So actually we had representative from each of the programs. So that was really great. And then this was really interesting. So I asked you, are you currently using simulation as an educational approach to teach your students? And 71% said that you are, but about 30% said that you're not. And so I think this is, again, a really great learning opportunity, especially for that 30% that have not started using simulation, but I'm excited that you're interested in learning more about simulation, and I hope that we can really provide just some great information and resources for you all. And then lastly, I asked, why are you interested in joining the simulation committee? And this was kind of before, I used the word committee, but this was before we kind of modified it to a learning community. And so it looks like most of you just want to network with other educators and just learn new ideas to incorporate into your own curriculum, which is exactly what this learning community is all about. learn new pedagogy, and learn about resources available were also popular options. We had 11 respondents say that they want to offer their expertise to new educators, which is amazing. And we have 2 of them that are speaking to us today about that. And so I think if if you do have experience in simulation, this would be a great resource to connect to somebody where you can share your experience with. We can almost establish like a mentor-mentee program, perhaps, through this learning community. And then share best practices with others. It was our other option. So I want you guys to save the date. I will be sending out a meeting planner, but we also, we already have our next learning community meeting scheduled. It will be on Monday, December 16th at 12 noon. This seems like a good time for most people. Again, this meeting will be recorded for those of you who cannot attend. And our speaker will be Nikki Beckwith. She is the director of the Master of Arts in Nutritional Sciences program at Syracuse University. And her topic will be on sensory impairment simulations. So we're really looking forward to having her. Okay, let's see. So I'll go ahead and introduce our 2 speakers for today. Okay. So our first speaker is Bettina Taylor. She has 20 years of experience as a dietetic educator and program director. She developed and started the dietetic internship at Meredith College in North Carolina in 1994, and then the coordinated program in dietetics at Delaware State University in 2016. In her current role, she teaches 4 clinical graduate courses, 2 undergraduate classes, supervises students' supervised practice, and serves as the program director for the CP. One of her passions has been to incorporate more experiential learning into her courses. Additionally, Bettina has been a program reviewer for ASIND for the past 7 years and has in previous years assisted with CDR's item writing and review for the credentialing exam. Our second speaker is Cathie Ostrowski. Cathie is a registered dietitian and dedicated professional with a wealth of experience in nutrition and dietetics. With a master's in dietetics and a current pursuit of a doctorate in clinical nutrition, she has perfected her experience over the years. As the dietetic internship program director and assistant professor of practice at Meredith College, she guides and supports dietetic interns in successfully completing an ASIND accredited dietetic internship. Her commitment to education is evident through her role as an adjunct professor, where she conveys knowledge in various classes. So I will go ahead and hand it off to our speakers.
Okay, I'm going to get started. Thank you for the introduction. We appreciate that. So we are going to talk a little bit about what we did at our universities. Okay, let me see. How do you move this slide forward in Zoom? I don't normally use Zoom.
If you go like to the bottom left corner, you see they have these 2 arrows. You should have control over that. Or if you say next slide, I can forward it for you.
Okay. All right. I think I'm going to have say next slide because I don't see the arrows actually on my computer. So if you could move the slide forward. Okay, so what we're going to do is we're actually going to talk we're going to talk in an interspersed manner. So we're both going to talk about the same things as we go through. So we're going to talk a little bit about the historical perspective of what we found at the universities where we are, and then what kind of needs we identified and what kind of funding sources we were looking for, and then some final tips and takeaways. Next slide, please. So in terms of the historical perspective at Delaware State University, when I started working here, it's about 10 years ago, they hired me to specifically develop the coordinated program in dietetics, and that pretty much took up the first 4 years of my tenure here, because we had to start from the beginning. They had a DPD and they wanted to transition to a coordinated program. And that was an undergraduate program until just recently. So this is our first year actually as a master's program, a master's coordinated program. So initially I was actually teaching different classes from the ones that are listed here. And so simulation wasn't initially on my radar, although I think it was in 2017, actually one of the people on this committee, I saw her name last time, Sandra Mayol Kreiser. I went to a presentation that she did, or a pre-fancy workshop that she did on simulation. And at that point in time, I decided that that's actually something really important to add, especially in Delaware. We don't have that many supervised practice sites, and there is a program here that has been here for a long time. So their students are basically at all the sites in the state, and we had a difficult time getting started and finding sites that would take our students or an adequate number of our students. So after about 3 or 4 years, the person that was teaching the clinical courses moved back to India, and so then I inherited all these clinical courses at the time. And I started teaching nutrition assessment. So mostly I'm going to talk about the lab that I set up for nutrition assessment, although of course we are going to do some other simulations in other classes as well. But when I took over this nutrition assessment course, it didn't have a lab. And so I immediately started having my students come to a lab that technically wasn't actually part of the schedule until I later could actually add that. And then once we started the lab, I recognized that we needed to add simulation for them to practice different skills. So when I started out, we really didn't have pretty much anything for an assessment lab. You see the kind of stuff that was available at the university. There were 2 skin fold calipers and a bathroom scale. And then there were some food models and this outdated bioelectric impedance. So what I'm trying to say with that is that I pretty much had to start from scratch. So Cathie, if you want to go next.
Sure. Thank you, everybody. Thank you for having me today. So if you could advance the slide, please. So at Meredith College in Raleigh, North Carolina, we were experiencing many of the same situations. We were finding that it was very difficult to secure clinical sites, and we were looking for other opportunities to expand, and we started thinking about the idea of simulation. So we first applied for an academy grant in 2013. We did not receive that grant, but it really got us thinking about where we wanted to go with our program and the resources that we would require, the training that we would require as well. So then we started thinking about an assessment lab. We really weren't thinking about a true simulation lab. We were just thinking about an assessment lab. And so we started to put together a wish list of the activities that we would like to do in the assessment lab. And then for the next 5 or 6 years, whenever we had a little bit of money in the budget at the end of a year, we would begin purchasing some of these supplies. And so you can see from the pictures here, we were able to purchase like a Susie Simon low fidelity mannequin. So that was our first kind of main purchase. And then we were able to add to that by purchasing some of the other items that you might see. We were able to purchase an ostomy bag. We were able to purchase ostomies, and then we were able to purchase PEG tubes as well. And so if you can advance to the next slide. Here's our Susie Simon sitting in a wheelchair. We had to purchase a wheelchair because she was just too heavy to move from room to room. But she cost somewhere around $1,000 at the time, and the wheelchair we just got on Amazon. And then these are some of the items that we just began purchasing through the years. One of our goals was for our students to be able to walk into their dietetic internship, to be able to walk into their clinical setting and know what they're seeing, know what TPN looks like, know what a PICC line looks like, know what edema looks like, the foot wounds, know what the ostomy bag looks like, know the difference between the ostomies, know the different IV fluids, the PEG tube, the NG tube. So again, just every year we kind of purchased a few items, and I was able to find a medical supply company, and as long as I signed a waiver that I was not actually going to use any of the products on humans, I could really purchase whatever I wanted to. So I purchased NG tubes and PEG tubes, and on Amazon you can buy so many different things. You can buy pretend TPN, and you can buy pretend IV fluids. And so we just started adding all of these things to our lab, even things like Foley catheters so that students knew what they were, irrigation syringes, an incentive spirometer, denture containers, and so on. And on to the next slide. So you can see these are some of the items here in the pictures that we were able to set up in our assessment lab on the right. So sometimes our mannequin, this mannequin is called Avery. Sometimes Avery had an NG tube and a PICC line. Sometimes Avery had ostomies, sometimes Avery was on TPN, and then we had some other trainers there. And even something simple as just a face mask to sort of let our students know, you know, somebody who's on the oxygen, sometimes it's very challenging for them to talk to you. So it was just sort of some visuals. We just wanted to have visuals for our students so that when they walked in the room, they were able to stay attuned and be aware of their surroundings when they went in the room. Now, after we started gathering some of these materials, we really didn't have a place to set up our simulation lab after our sim lab. So the upper left-hand corner is Wake Tech Community College, which is a technical college near us, and they were so generous sharing their simulation space with us. So this was an empty room, and they let us use the empty room. We ended up putting one of our staff members right into the bed and began simulating things with her, and we created a whole NFPE video using her as our patient. So be sure that you're utilizing the ability to work with other sim labs in your area or just other nursing programs in your area. And then on the bottom left, there is our current simulation room with a high fidelity mannequin. And so I'll be talking about that in just another minute. So our next slide, here's another example of our assessment lab. So our students would move from table to table, going through all of the activities at each of the tables so that they could practice all of their assessment skills. So this was just a classroom, and everything is normally stored in a cabinet, and I would pull it out for our assessment lab, and then I would put it away again. But the most significant phases are on our next slide. So again, that kind of started in 2013, and then in 2022, yes, we were able to purchase our nursing and simulator, and there's her price tag there. Our nursing and simulator is on these slides. And so our nursing and simulator is male, female, older and female. We also purchased a wound kit, a warranty pump, warranty enteral pump, and a head wall. You can see the head wall located there, but the mannequin itself was $65,000 there, but we loaded everything up to it. We got all the kits that could go along with it. Then a year later, we purchased technology for the room. So we were able to get a 55-inch monitor, you can see on the bottom right, and some cameras and microphones for the room. And then recently, just last week, we were able to get a new used bed. And we were able to get this new used bed through North Carolina surplus, so the state and federal surplus. So they were able to get a medical bed from a local hospital, and then they sold it to us. And so we were able to just purchase that bed last week for $1,000. And I'll tell you about funding later on. And then our last phase, which is still pending, is we were able to get matching cabinets from a cabinet company who donated all of their cabinetry to us. They're also going to give us a side table because we don't have a side table for the hospital bed. And then our flooring came from a grant. So I'll talk to you about that later on. But then just on our next slides, you can see we have our older female and our younger female. So this is the same mannequin. It's just zipping off the skin, zipping the skin back on, and changing the wigs. So this is our older and younger female. And then on the next slide is our older and younger male as well. And so we were able to secure our bed through the North Carolina surplus. There's a state and federal surplus. They didn't have a medical bed, but we put in a request for it. And so they have all different types of equipment, office equipment, and so on that are at reduced prices. And so I put in a request for a medical bed, and they were able to secure a bed from Camp Lejeune, actually, the Marine Hospital here. So that's where we are now. We're working on our last phase, like I said, with flooring and with cabinetry. But the picture on the right here with our older man is that's our new bed right there. Okay.
All right, so after, we evaluated what we had and where our starting point was, and as you can see, they were different for our two institutions. Then the next step was for me that I needed to identify the needs that I had for this assessment lab, and then also to implement the new clinical skills that are in the 2022 standards. So next slide, please. So there are obviously, when you look at the competencies and for the DBD, the knowledge requirements, there are obviously some specific clinical skills that correlate with simulation, but there are many other competencies that you can also help students achieve through simulation and through these assessment opportunities and experiential learning. So, like, for example, cultural humility in the interaction with colleagues, staffs, and clients. So if you have students dress up as people from different cultures, or you dress up your mannequin as a person from different cultures, you can teach a lot of competencies in how to interact with people from other cultures in an appropriate manner that is not offensive. And so I just wanted to point out with this, obviously we have like lots of competencies and knowledge requirements, and many of them can be practiced through simulation, or you can actually meet them through simulation. So I really appreciate that the Academy provides that opportunity for us. Next slide, please. So after I looked at the situation in terms of not having really any lab equipment for an assessment lab to start with, the other thing that I was thinking of was that also I did need some training. So I identified that both in the area of experiential learning and developing experiential learning modalities, and also in simulation, that I didn't have really a significant background in either of those areas. And so I did, as the next step, a lot of training. So, I became Quality Matters certified. That's an online certification, but they spend a lot of time talking about experiential learning experiences. And the same thing is true for AQ and the American Council on Education. And then at the university, they have like a Center for Teaching and Learning, and they actually did a lot of training also on experiential learning. So I, first of all, felt like I wanted to inquire some additional knowledge specifically in that area. And then in addition to that, in addition to the experiential learning, also on simulation. So you're probably familiar that NDEP actually has a Simulation 101 webinar that we can access. I did a certification in simulation at Drexel University in Pennsylvania. That was helpful, although I don't think it's necessary to be able to implement simulation. And then, there are different trainings that are available, like the nutrition-focused physical exam hands-on training workshop by the Academy. And when you go to Fancy, they sometimes have training in simulation. There are different things available online. So getting some training is really helpful to be able to kind of think through what you need and how you want to implement simulation, because when you look at all the items that Cathie was discussing just a minute ago, that's wonderful, but you can do simulation with much less. You can do simulation just with, a couple of students, one of them being an actor and another student. So the writing up of the simulation experience is really the important part. And it's something that, we can get started with it right away. And I wasn't aware of that actually at the time. I thought that I needed all this training to get started, but that really wasn't necessary. So I want to encourage you, those of you that don't have a simulation lab, it's something that you can actually get started with from the front. Next slide, please. So then the next item, I did spend some time kind of trying to figure out what kind of things do I want to purchase specifically for my nutrition assessment class. So, on my list, there are really not some of the clinical items, because I do also some labs in MNT. So that was for my assessment class specifically. So, I needed more food models, and then, to do anthropometric measurements, obviously you need certain items to do them effectively. And then we needed some stuff for implementing these new clinical skills, like taking blood pressure. So stethoscopes, that wasn't really available here. Doing, blood glucose measurements. So we needed diabetes testing kits. So when you look on here, so the prices are all for one. So, depending on how large your program is and how many you need per student, you could obviously expand that. I just put the prices because I thought it might be helpful to kind of see what things approximately cost. So when you get started, you can decide what you really want to invest in. And you can see that some things are not that expensive and others are more expensive. So I did actually purchase a medical exam table because the space that I have doesn't actually allow for a hospital bed. And I bought the stuff for students to do the nutritional focused physical exam, such as an edema trainer that you see there, and you see the hand dynamometer in the picture. I also bought a dysphagia game that I originally wanted to use because I do the dysphagia screening in nutrition assessment, but the game is really more appropriate for another class, so I'm not going to use that anymore for this class. Then next slide, please. And so my students don't have that much access to a pediatric clinical experience. We only have one children's hospital. It's not very close to the university. And currently they do not take our students. So I wanted my students to get some pediatric experience. So I actually bought a pediatric simulator, as you can see here. I also bought a Hispanic baby model. And so I bought some things so that my students could actually do the measurements in an appropriate manner that you would do in a pediatric setting. Most of them are more for the community. The MUAC Z-score tape would be something that you would use in a hospital with more high acuity infants. So I invested in that specifically because I wanted my students to have that experience if they couldn't get that during their clinical or community rotation. Next slide, please.
So with Meredith College, we did have some food models. However, nobody used them because they were all thrown into, they're the NASCO food models, they were all thrown into a big suitcase. And if you know anything about the food models, over time they kind of melt together. So we had to get a bit of student help, and we had to salvage as many of them as we could. And just all of them in one big suitcase was very hard to transport as well. So we did pull out and salvage as many as we could, and then we put them into nice drawers on wheels so that we were able to use them. But the important thing is that we did actually have what we needed. And we didn't really have to add on to it because you don't need a lot of food models, you just need a few. So we just had to get them out and begin using them in a more appropriate manner. We did have some medical scales and some measuring tapes, but we have had to purchase stethoscopes, a diabetes training kit that we got from eNASCO, and I put the price there too, a Sharps container. We were able to get a medical table donated from an alumna, and it just sort of happened. One of of our alumnas was doing medical photography and said, hey, we have this medical table, we're going to trash it. Do you guys want it? And we said, yes. And they said, it's only been used for medical pictures and that's it. And the company's done with it. So they told me to dispose of it. And so I will bring it to you. So they were able to deliver it to us. We were able to get that free, and the few other things there as well. So again, very similar to Delaware State there.
So then the other item is, of course, that, when you are wanting to purchase these pieces of equipment, that you need to kind of come up with some funding sources. And that can be more or less limiting depending on the institution where you work. So I definitely did have to come up with some funding sources. So in 2020, I applied for a USDA capacity building grant that was actually not funded that year. But because I did a lot of research for that grant, then I also knew kind of what I wanted to purchase and how much it cost, because I had to put that in the grant. So then I was able to apply for a mini grant at Delaware State University. Because I just had done all this work, then I just decided in the mini grant to just apply for the pediatric items on the grant. The mini grant was for $2,000, so it was a small grant, but it allowed me to buy pretty much everything on the list for the pediatric items. And so that's the first one that I implemented. And then the following year, I reapplied and received that USDA capacity building grant. There are a lot of institutions that get alumni gifts, like Cathie just mentioned, with one of the students. So we don't really have that available at this present point in time because our coordinated program just started. So maybe that's something to look at in the future. Sometimes you can get donations from companies, though. So that's also something to explore. And we charge our students a small lab fee. It's not very much money. It's like between $25 and $50. But if you have a lab fee, since they use the equipment, then over time you can at least maintain your lab and potentially buy some additional items. And Cathie shared earlier, you can use other health professions' labs if that is something that is possible at the university where you work. For us, that's not really exactly an option because we are in the College of Agriculture, Science, and Technology and not in the Health Sciences branch of the university or college because my department chair wants us to be able to access the USDA grants. And so if we move out of the college, then we would not be able to access them anymore. So we have also a food science graduate program, so that wouldn't really fit with the health sciences. So that for us is not an option, but I know that many other schools do that. Next slide, please.
So I was able to get some funding from mini grants. So we were able to get about $500 left at the end of each budget year for several years, maybe 3 to 5 years, something like that. Again, to just purchase items and then store them appropriately so that they would last throughout the years. We do have the ability to apply for faculty development grants in the amount of $1,500 twice a year. You can really only get it like once every 3 to 5 years though. So it's not anything that's continuous. It's like a one-time a grant there. And so I was able to secure one grant to develop simulations for our simulation lab. The bulk of our funding came from institutional advancement. So for our mannequin, we were able to go to institutional advancement. I just simply put together a PowerPoint presentation and met with institutional advancement so that they could go out and look for somebody who would fund our lab for us. And what really made the difference is that our lab, although it's used primarily by nutrition, we've offered for other disciplines on campus to utilize it. And only one other group has asked to use it on campus. But the thought was that it is available to other groups, and that kind of went a far distance in terms of institutional advancement. They weren't looking just for the nutrition, they were looking for other programs as well. I was able to get some donations off Facebook. There's a Buy Nothing group and a community gifting group. And so I was able to get things like wigs and other clothing and those types of things. for our lab, and I was able to get an IV pole. I was able to get leftover medical supplies that are sealed, sealed medical supplies that haven't been able to be used. I was even able to get some old tube feeding, which just for simulation purposes only, from our Buy Nothing group, and then also from other from formula companies as well. We do have small student fees. Our college really likes to use the student fees for disposables, but we are able to purchase a few tiny things with that. And then again, using other professions' labs. But certainly start small, be creative. Don't forget to maybe correlate and use your theater program on campus so that you could have standardized patients for simulation as well. You can put together things like avatars and cartoons for simulation online. And you can also build an escape room. I build an electronic escape room for my students so that they could practice some of their skills using a Google form and using PowerPoint. And then that's how they sort of get out of the classroom a couple times a year. I give them the last 30 minutes of the class, and they have to go through this electronic escape room. And then so if they do it the right way, they can get out pretty quick, but sometimes it takes them a long time. But certainly there's lots of things out there that you could utilize that just takes time, but maybe doesn't always have a cost to it. Next slide.
Next slide, please. So at the end, I just wanted to briefly go over, how you write a simulation scenario. That's really introductory, what we're going to do now. Next slide, please. So I just wanted to point out that an important part of a simulation is actually that the students reflect on their learning experience. So if they're just doing an experience, but they don't reflect on how they are implementing it, then they're not going to learn very much. So it's really important to kind of go through this whole cycle. So that's why I included this slide here. So it's not only to be present in the experience when they're doing the learning, but also then afterwards being able to actually describe that experience and kind of differentiate between the different things that happened and to analyze what occurred and if what occurred was actually helpful, or maybe if it could be done in a different manner the next time, and then or go through this experience again. So for example, if you do like training for a dysphagia screening, allow the students to go through this screening exercise with the patient and then talk to them about what they did and what went well and what didn't went well and why certain things didn't work the way they expected them to, and then allow them to do it again until they actually achieve the competence that you're looking for. Next slide, please. So I wanted to just mention, how you write a standardized patient case. So, a lot of the work with setting up simulation experiences is actually in writing up the case and thinking about all the different items that need to be included. So, when you think about a simulation, you want to have a patient, you need to name that patient. So it's helpful to have a name that could be either male or female. So you can use, if you're using students or people, then it can go either way. And you need to give this patient some kind of a background, socioeconomic status, maybe religious background, their age, where they're living, if they're having assistants at home. So, just describing the patient background, and then think about how long it will be necessary for the student to actually prep for this experience, right? So that, when you're giving them a case and you're presenting them with a problem, which is the patient scenario in the next step, you're going to have to kind of think through, well, how long is it going to take them to actually put together what they need to be an effective dietitian or dietetic intern in this situation. So, I normally give my students about 10 minutes of prep time, and then allow 15 minutes for the encounter. And then afterwards, I schedule some feedback time to discuss with them how it went and what happened. Now, we have a small program, so I'm normally present when my students do that, but in large programs, that's not really, that's probably not possible for the instructor. So if you are actually using trained patients, so either theater students or some universities actually hire people to be patients, then you need to plan also on how you need to train the patient for this scenario. So for the patient, you have to plan what the patient says first when the student comes into the room. So, you're going to have to give them an opening line. And you also have to describe what the patient looks like. Are they in a hospital gown? Are they dressed in street clothes? Is there anything visible on their body, like some wounds, like a pressure ulcer or something, that you want the student to see? And then you want to also prepare some challenge questions. Like if you have a woman that has diabetes, maybe the challenge question could be that you could ask about eating fish, and her worries about the fish being contaminated. And then you could, talk about different heavy metals, maybe some that are actually not found in fish and some that are found in fish, so that the students, will be needing to answer the questions that the patient has. So if the patient is the evaluator, then you're also going to need some kind of a checklist for the patient to go through afterwards when the student is done, so that they can evaluate the student's skills. So that could be communication skills, like, did they make eye contact? Did they make the patient feel comfortable? Were they really nervous? Did they have like certain behaviors that were distracting? Their physical skills, if they did a nutrition-focused physical exam, for example, or something like this. And then any kind of patient education that the students did. So, kind of coming up with that scenario does take some time to think through. So it's not something that you can just do in a day. Sometimes it helps, to run through that case one time and see how it goes, and maybe add some things or take some things out. I have actually done those kind of things as part of exams too. So in my nutrition through the life cycle exam, I actually have my students do an oral portion for the exam, where I'm then wherever we are, the elderly person or the woman that is infertile or the woman that is breastfeeding. And, I'm going to have them answer questions and give me some instruction. And, I ask them questions so that they can get some experience with that. Next slide, please. And then, the next slide, please. Oh, okay. Yeah. And then, then you have to plan for the assessment and, what is important for you in an assessment. So the assessment could actually be the debriefing after the experience. So that wouldn't necessarily be graded. It could be, or if it's a competency that you're assessing in the class, then you probably want some kind of a skills rubric, or maybe even a reflection rubric, and maybe both. So, like, for example, with the dysphagia screen, I developed a skills rubric because, I need to make sure that my students actually meet that competency, and it's measured in the assessment lab, because I can't guarantee that they're going to be able to do that at the hospital at this point in time. But I really also like the debriefing. And so I just added some of the debriefing questions here. So you kind of have an idea of how you would do the debriefing, right? So during the debriefing, you don't just want to focus on their educational performance, if they answered the questions correctly, but also you want to kind of focus on how the student felt in that situation, right? So you want to discuss that too. Like if your case is somebody that's on a hospice, right? The student then also is going to have to kind of think through, how am I going to interact with somebody that's actually dying? How am I going to feel about that situation? So you want to, in the debriefing, do not just the clinical part, but also that part. And the benefit of debriefing is that you can actually ask the person why they did what they did, right? When students take an exam, they write something down and you're looking at it and you're like, wow, they missed the point. I just graded some exams right before this, and I was looking at some stuff that my students did, and I was like, oh. So, but, in a debriefing, you can say, I noticed that you gave your patient only this many calories, with your tube feeding. What were your thoughts behind that? And so, frequently you can then correct the thinking behind something. And if it's done with, the class, then you're able to actually help all the students learn. So this is just a starting point, but I put these questions there. So if you're interested in incorporating debriefing, which I think is really beneficial, that can give you a starting point. Next slide, please.
So our final tips and takeaways for you, we want you to not get too overwhelmed with some of the advice that we have for you, but certainly start small. Just select one course or maybe one rotation for your students. Identify your student learning outcomes first, and then describe the anticipated benefits, and then build your activities from there. Do seek feedback from coworkers and from students, reflect on performance, and explore new ways to meet some of these competencies. All right, next slide, please. All right, so here's our contact information. And if you have any questions, we'd be happy to answer them for you.
Well, Bettina and Cathie, thank you both so much. This was such a wealth of information. Really enjoyed it. Yeah, if you have any questions, please unmute and ask the speakers, or you can feel free to type it in the chat. So we do have a question. Comes from Shayna. How many students do you have doing Sims at one time?
Bettina, do you want to go first?
Well, we have a small program, so, I can have all my students do it at the same time. So actually, Cathie, I think that you would be a better person to answer that question because you have more students.
Yes, so we do 4 students at a time in our space. Our space is 200 square feet, so there's just enough room for 4 students and myself as the instructor. And then we use cameras to and Zoom in order to send the video down to the classroom. So we're not able to have a control room. We don't have a control room. We don't have two-way glass. We don't have our own debriefing room. So we have to use classrooms, but we do them, the students 4 at a time is what we're currently doing. Mm-hmm.
And we have another comment from Celine. She said, I would be interested in seeing examples of the reflection rubrics. Now, is there a website that you go to, or were these rubrics created by yourself that perhaps she can reach out to you? Would you be willing to share them?
Sure, yeah. Just send me an email.
Okay, great. Jesse says, thank you for sharing the costs, starting to apply for grants now, and that was very helpful. And I agree, that was
Great news.
super helpful. Okay, well, it seems that there's no more questions, but of course, please reach out to the speakers personally if you want to learn more information about anything that they share today. And we'll go ahead and conclude today's learning community meeting. And I hope to see everybody next month. And please be looking out for an email and a meeting planner for me for that invite. Hope y'all have a great week.
Thank you.
Thank you. Bye now.
Bye-bye.